Welcome back, everyone. This is Doc ID, and today we're going to talk about the first COVID-19 home-based test. So, the FDA has recently granted an emergency use authorization to the company called Ellume for an at-home testing and sample collection for COVID-19. The diagnostic kit produced by an Australian diagnostic company is the first coronavirus test in the US that can be operated entirely by the user at home and bought over the counter without a prescription, whether you're symptomatic or asymptomatic. These tests will be available to buy in the US from pharmacies, drugstores, and online sites. The kit itself is supposed to be around $30 or less. So, according to the FDA, the test kits correctly identified 96% of positive samples and 100% of negative samples in people with symptoms. And people without symptoms, the accuracy was slightly lower, with the test correctly identifying 91% of positive samples and 96% of negative samples. So just like any other antigen tests, which provides faster results, they are less sensitive than the gold standard PCR tests. So as a result, the company has said that people without any symptoms who test positive should consider themselves infected and they can self-isolate, but then going and getting another test done as soon as possible to confirm the results. In addition, people who test negative but do experience COVID-like symptoms should really follow up with their healthcare provider again to confirm whether they're negative or not. So how does this at-home COVID test work? The diagnostic kit is a type of antigen test that detects fragments of proteins from the coronavirus in people aged 2 years up to 82 years. The test itself includes a nasal swab, a dropper, a chemical solution, and a testing strip. People do a nasal swab, which is then placed into an analyzer that connects to a smartphone, which can be an iPhone or an Android, through Bluetooth. By using an integrated smartphone app, individuals can then view the results in as little as 20 minutes. The app does require users to enter only their zip code and date of birth, while people also have the option to type in their name and email address. Results will be reported to public health authorities if it's positive, inappropriate, when it's positive and it's appropriate to help track the spread of COVID-19. Results can also be shared with healthcare professionals so that they can receive the appropriate treatment if it's necessary. I think this is a major milestone in diagnostic testing for COVID-19. By authorizing a test for over-the-counter use where a patient can buy it, swab their nose, run the test, and then find out the results in as little as 20 minutes is absolutely amazing. Just one thing to keep in mind is that this test, like the other antigen tests, is less sensitive and less specific than your typical molecular test, which is run in a lab. However, the fact that it can be used completely at home and return results quickly means that it can play an important role in response to the pandemic. The test kits hopefully should be start rolling out in February through July. In my opinion, I think again this is a great test for people to determine if they have COVID-19 when they become symptomatic. So we are heading in the right direction to beat this pandemic with all these resources we're getting and utilize it. Don't forget to subscribe to the channel and hit that notification button so that you can get the latest videos when they start coming up.